Guys, can you hear me and can you see my screen? Good. Okay. So, all right. Thank you. Well, let's continue. So we were talking about the part of the forearm here where we talked about the region of the elbow joint. Now let's go through the radial ulnar joints. One of them we talked about, this was the proximal ulnar joint, radial ulnar joint, sorry. And here we do have a part of the proximal distal radial ulnar joints, which you can see very well on this particular pictures. This is the radiological image, as you can see, and here you can see particularly how the part of the radius produces the on the distal part of it produces the pronation and the supination. So in the case of the part of a joint here, as you can see between the ulna and the portion of the radius, here we even do have a part of the articular disc, because the movement at this region, as you can see, is very extensive. Still the supination and the pronation is seen here, and as a result the let's like a cushion for the shock absorbing is here particularly represented by the articular disc, as you can see. Now what you can see here, these are the part of the wrist and the portion of the hand, as well as the forearm. So, and what do we see in this case? This is how it looks like, the portion of the articular disc, how it is projected here, as you can see. So, and as a result, we said that normally when we talk about the wrist joint, we call the joint radiocarpal. Why we call it radiocarpal? I do believe it's clear that there is no attachment to the portion of the carpal bones by the ulna. Although in the case of the radius, it is seen here, or also seen in the previous nice picture, it shows you the inferior view, and that's where particularly you do have two large facets for the articulation, and particularly in this case we do have a part for the portion of the scaphoid, as well as the part of the lunate that is particularly seen here, as well as important part. You can see that we do have the collateral ligaments also at this region, as you can see here on the lower region, and that's where we have again the radial collateral ligament, as well as the ulnar collateral ligament on the region of the carpal bones. Now, what is also interesting for us here is that we recognize the part, not only the radiocarpal and radiocarpal type of the joints, but also we do have the midcarpal joints, as you can see particularly here, which is localized between the distal and the proximal rows of the carpal joint, of the carpal bone, sorry. So as a result, here you can see a very close association of the bony structures to each other, although it still gives rise some movement, particularly most commonly when we talk about the movement at the region of the carpus. This is mainly the type of the flexion and extension type of the movement. So it is, compared to all of the other types of a joint, it is much we could say limited in this case. Now let's see how it looks like the parts of the different ligaments. So here, as well as internally, what do we have in the part of the, this is, do you remember, scaphoid and the part of the lunate attached to the region of the radius. Here you can see that even the part of the articular disc, which is protruding towards the part of the radius, as you can see here. And you see that interiorly we do have the part of the synovial membrane. So, and as a result, these type of ligaments are simply called as the radiocarpal type of the ligaments. Here, this is the anterior view. Anterior view in the anatomical position means that it's the palmar region, yes. So, as a result, we can say here that all of these type of the ligaments, as you can see here, these are the radiocarpal ligaments from the palmar surface, okay? So, from the anterior view itself. Also, what is interesting to see here is that covering these ligaments we do have like a bracelet. Let's say like that. This is the part of the flexor retinaculum, as well as we have the same thing on the dorsal surface where we have extensor retinaculum. So this is the part of the ligament which is reinforcing the part of a wrist joint, and you know how it helps to not immobilize, but it helps to how to say, order the tendons of the forearm region. Because in the case of the forearm, in the anterior part and the posterior part, or ventrally and dorsally, we do have a large amount of muscles which are with their tendons overriding or crossing the wrist joint, and then are attached either to the part of the carpals, that's in the very, very rare, or in the portion of the metacarpals, sometimes in the part of the phalanges. As a result, imagine how many large amount of these tendons are crossing the part of a wrist joint. That's why we do have here the part of a flexor retinaculum, or we also call flexor and extensor retinaculums, or also we call them the part of the transverse carpal ligaments, which are surrounding the whole of this structure. I mean the part of the wrist itself. So here, sure, you can see the different types of innervation blood supply, but I'm not interested in that portion. So what I want you to remember, these are what are the main ligaments here. What is the radiocarpal ligament? Where do we have it? As well as the collateral ligaments, or in the case of the elbow joint, in the case of the wrist joint. Okay. So also, what is interesting here is that for us is that particularly the how these ligaments are attached and to which particular parts they are attached. So you can see that most of the carpal bones are having this attachment to the radiocarpal ligament, as you can see from all of the sides, to strengthen their location as well. So this is anteriorly and posteriorly, so from the palmar surface and from the dorsal surface, as well as from the regions of the lateral and the medial side. If we talk about the anatomical position, yes, in the case of the medial portion, we do have the ulnar collateral ligament. On the other side, on the lateral side, we do have a radial collateral ligament, as you can see particularly here. Now, what is also interesting for me in this case, okay, let's continue. No, just a second. Here was a nice picture, if I remember correctly. Okay, no, unfortunately. All right, so the next portion, what do we have here? This is the part of how do we have the movement of the hand, as you can see here, and at the region where we do have a part of the carpals, and here are these are the tendons, by the way, which I told you that which are passing through the carpal region and make the movement of the part of the hand, which are coming mainly from the forearm. So let's see what are the, first of all, the most common movements at this region. As we said, these are the extension and flexion. Most commonly when we talk about the region of the carpal surface. That's why you will see that when we'll talk about the muscles of the hand, they are, muscles of the forearm, which are moving the hand at the wrist joint, you will see that, as I said, all of them are subdivided into the anterior compartment. We have a flexion, the ones which are making the flexion, and we have the extensors, which are making the extension. As a result, we have the flexion and extension of the whole hand at the wrist joint. That's why you will see that we have, for example, flexor carpi radialis, flexor carpi ulnaris. So these are, I will talk sure about that muscles later. What I want you to understand, that these particular tendons, when they are overriding the part of the, or crossing the part of the carpal joints, okay, and most commonly are associated with the metacarpals, as a result, mainly what they will do, this is this type of the movements. That's why it's written here. Do you see FCU stands for flexor carpi ulnaris, and the flexor carpi radialis. As you can see, these are these tendons which I was talking about. So this is the part of the anterior view. Anterior part. This is the posterior in anatomical position, I mean. Okay. So although itself the view, as you can see here, it is sorry, it is inferior view. So where this is the lateral portion. Okay. This is the part of the how do you call it? The radius. So this is mainly, imagine that this is the left hand, and the view, inferior view from the region of the wrist joint, okay? But only the parts of the radius and the ulna. Is this part clear what you see? Yes or not? Yes or not, guys? I need to know. So as a result, good. As the result, what is happening in this case? Look, you do have the tendons of the muscles of the forearm, such as flexor carpi ulnaris, flexor carpi radialis. Do you see that they are literally passing on both of the sides of the wrist joint? As a result, you do have here the flexor retinaculum, which helps to arrange or order these particular tendons in the position. Also, from the other side, you have the extensors here, as you can see. So extensors carpi ulnaris, and here we do have two of them. These are extensor carpi radialis longus and extensor carpi radialis brevis. That's why you have ECRL and ECRB. So as a result, what they do here, you see that one thing, yes, they make the flexion. Yes, they do have the extension. At the same time, if it is portion of the ulnaris, yes. So in this case, because it's anatomical view, it will make some adduction, sorry. And in the case of the radialis, it will give you some abduction. So as you can see, these particular movements, yes, are dependent on what? That these tendons are arranged in order, as well as covered by this transverse ligament, or simply the flexor retinaculum here and extensor retinaculum on the posterior side. Is this part clear, more or less? I do believe it's understandable, yeah? So here they just show you what is abduction and adduction at the portion of the wrist joint, and I do believe it wasn't very difficult to understand. The last portion, but not least, what I want to go through, this is itself the part of the hand, and not clear. What is not clear? Henriette, what is not clear? Okay, let me show you it again, how it looks like. Look at this region. Do you see the part of the wrist? How it looks like? Yes. So as we said, in the case of the wrist joint, we use only the part of the radius and the proximal row of the carpal bones. Particularly, it makes direct attachment with a part of the scaphoid and the lunate, which are more laterally localized, out of the all of these four proximal type of the bones, where we have also the part of the triquetrum and the pisiform, as you remember, yes? So as a result, when we do have a portion of the radius here, you can see, and okay, let's go back to see the bony structures first to understand what I'm talking about. No, here better. Yes, here it is. So you can see here the part of the radius. Am I right? Do you see that? And this is the part of the proximal row of the carpals. So in the case of proximal row of the carpals, because the radius in anatomical position is more laterally localized, you do have the part of the scaphoid and the lunate, which are two main bones here on the lateral side I'm talking about. Then we do have the triquetrum, and residing on the triquetrum we have a pisiform, but these two are making the direct communication or articulation with the radius. The rest, as you can see here, normally should be articulating with the ulna, but the ulna here has a very small head, and as a result, it doesn't have the direct communication with the lunate and the triquetrum. In this case, it does have the part of the articulate disc, which you can see even in this nice picture. Look. This one. This is the internal structure. This is the part of the radius. As you can see, the distal end of the radius, okay? And what do we see in this part? We do see that we have the articular facets for the part of the scaphoid and the part of the lunate. That's what you can see here. These are themselves the carpal bones, which are covered by the cartilage. That's why they are in a bluish color here. They are literally small, so sure they will be covered by the cartilage. And as a result of this region, this is the lateral part in anatomical position. Yes, this region. So you do have scaphoid residing in the portion of the distal end of the radius, and here you do have lunate, which is also residing in the distal end of the radius. At the same time, we said we do have here the part of the articular disc, yes, that even you see that we have the part of the articular disc, how it is invaginating towards the portion of the radius. You see? Is this part clear what I'm saying till now? Yes, good. So the next thing what is interesting for us here is that what reinforces this particular joint, as well as if we said that we have the joint between the radius and the proximal row of the carpals, clear to understand that here we will have the part of the joints between the proximal row, as you can see here, as well as the distal row, yes? So simply, as you can see here, we call it mid-carpal joint, which is localized in between of proximal and distal row. Yes or no? Yes. So as the result, to reinforce this structure, as well as you do have here the next type of the joint, which is carpometacarpal joint, meaning that this is the distal row of the carpal bones, which is attached to the metacarpals now. Yes, so in this case, what can reinforce these particular articulations? And here comes, you see, that anteriorly and posteriorly, we do have the part of the radiocarpal ligament. It is like a broad structure. Can you see how many there are? So this portion is the radiocarpal ligament, as you can see. This portion is the radiocarpal ligament, as you can see, going towards the part of the triquetrum even, of the proximal row. Here it comes towards the part of the capitate, as you can see here, yes? So here you can see the part of the attachment of the distal part of the radius with a portion of the lunate. So all of them together are producing a large band, which is covering anteriorly. How we understand it's anteriorly or in the region of the palmar surface, yes, because it's, in this case, you can see that it is more medially localized. How we understand that it's medially localized, guys, you can see the part of the ulna. So the smallest bone in the case of a distal end always will be the part of the ulna. That's why we understand that this is the medial side. Here you do have a lateral side of a radius. As a result, we do have the attachment of all of these ligaments, and as a result we have the reinforcement anteriorly, as well as the same thing we have posteriorly, but now it will be the dorsal radiocarpal ligament, and as a result, them together, they are reinforcing the part of the wrist. At the same time, if you have it anteriorly and posteriorly, we also do have this in the same manner as it was in the case of the elbow joint. You do have the collateral ligaments on both of the sides, where you have the ulnar collateral ligament as well as the radial collateral ligament. Do you see? Yes. And as I said, coming back to that picture which showed you here, look, what is this? What is the view? As I said, this is mainly the part of the left hand. Just take your left hand, okay, and imagine that you want to see what is happening starting from the radius towards the ulna, okay, from the inferior view, from the distal view here, okay? So that's what you see. Here you do have a part of a radius, and here you do have a part of the ulna, as you can see. Here is, so this is the anterior view, okay, in anatomical position, and here is the part of the posterior or dorsal region. As a result, as I said, most of the muscles of the forearm with their tendons, they are overriding or crossing the wrist joint, okay? So as a result, they are mainly taking place in the movement of the upper of the hand, either in the wrist joint, as you can see, or in the digits. So as a result, what type of a movements we can have here? This is easiest one, yeah? So in the case of the wrist joint, mainly we can produce the movement which is flexion, as you know, so in anatomical position, flexion or extension. Am I right? Flexion, extension. As a result, I told you, I don't want you to memorize now the muscles, just to make you to understand. Then what is also seen here? You have FCU, stands for the tendon of flexor carpi ulnaris muscle. FCR stands for flexor carpi radialis, meaning that these are two muscles which are originating from the forearm. One which is both of the flexors are originating from the anterior surface, yes, and then passing from both the medial and lateral surfaces. Why? Because ulna is medial most, the radius in the lateral most, and as a result pass towards the part of the hand, okay, to give me the movement from the name flexor carpi radialis or ulnaris, doesn't matter for me. In both of these cases, it will give me mainly the flexion, yes? So both of them will pull the part of the hand, and as a result, we'll have the flexion in the wrist. Vice versa happens for the extensors. So we do have here the ECU, standing for extensor carpi ulnaris, as well as the ECRL and ECRB, standing for extensor carpi radialis longus and extensor carpi radialis brevis. So as a result, here we do have two tendons, but the main idea is that, again, what they do is that passing through the carpal region, attaching to the part of the hand, they are making the extension of the hand at the wrist joint. And that's why we said we do have this flexor retinaculum here, which they showed you. I'm sorry. I'm sorry. So here particularly how it looks like, or even here. So this is like a band, like a bracelet surrounding the whole portion of the wrist to, as I said, to make all of the tendons. Imagine how many tendons are passing through the region of the carpus on both of the sides, because not only the movement of the hand in the carpal joints is present there, but also in the part of a metacarpophalangeal joint, metacarpophalangeal joint, as well as phalangeal joint, interphalangeals we call them. So any type of the movement in this case is dependent on most of the muscles which are coming from the forearm. Is it clear? So as a result here, what do we have is that we do have this part of the flexor retinaculum to produce this band and cover the whole portion of the carpus to like make all of this tendons in order. Just a second. Just I don't know why we don't have it here. Maybe it have it somewhere else. But just a second. I want to show you how it looks like, and I do believe it will be in the portion of the forearm, in the part of the muscular region. That's for sure. Yes. I remember this picture. That's why. Look this part. This is the portion of a distal row of the carpal bones. Do you see? And do you see how many different tendons are here for most of the flexors? Why flexors? Because it's the anterior portion. That's why it's the flexor. So as a result, you have here flexor retinaculum or transverse carpal ligament, which is, as I told you, gives them surrounding to, first of all of the carpals themselves, as well as the tendons which are associated with that region. If I remember correctly, there should be somewhere the extensor retinaculum also. Let me check, please. Just a second. Just a second. Yes, extensor retinaculum. I remembered correctly. So do you see, this is the posterior view, the dorsal portion of the forearm. As a result, the muscles, do you see, most of them are extensors. The different types of the extensors, they are the ones which are producing here. So, and as a result, they are going through passing through the part of the corpus, and as a result, covered by the extensor retinaculum type of the ligament. Do you see? Now, Henriette, is it clear? Good. I'm happy. And let's continue with the last portion that we do have. You're welcome, my dear. So, and the last parts what I want to talk about, these are the metacarpal as well as the phalangeal region. And in this case, what do we have? So again and again, when we talk about the metacarpal and phalangeal joints, we should remember that we have them metacarpal phalangeal joints, first of all. So between the metacarpals and the proximal phalanges, as you can see here, yes, that's what very nicely seen here. This is the part of the metacarpals, do you see? And this is the metacarpophalangeal joint. This is the first proximal phalanges here. And as a result, you can see that we do have, again, the part of the collateral ligaments on both of the sides. That's what you can see particularly here. This one and this one. Do you see these? Do you see how they look like? As well as we do have like a band surrounding the portion of the palmar surface. You can see here the part of the palmar ligament everywhere here. Every and each is surrounded by that type of the palmar ligament. Do you see how it looks like? And on both of the sides from that region and from the other region, from the other side, we do have a part of the collateral ligament there. Also, in the case of the interphalangeal joints, as you can see that in the case of interphalangeal joint, we do have, again, the small types of the collateral ligaments here, as you can see. And what is the most interesting for us is that movement which can be performed by the interphalangeal joint. This is mainly the flexion and some extension, but extension is very limited. I do believe it's clear. But the metacarpophalangeal joint, you see, it is much more, as you can see here, or here particularly, you can see not only the simple flexion and extension can be produced in this case, also the part of the abduction and even the adduction can be seen in the region of the metacarpophalangeal joint. I don't know if we have a nice picture, but better picture in this case, but okay, no, unfortunately. But what you can see is that this particular surrounding of all of these ligaments is helping us to reinforce, first of all, this movement, and as a result, the structures, and as a result, produce the most of the movements of the hands, such as again and again. It can be flexion extension, which is the most common, but at the same time, because we have the accurate type of the movements, do you remember we've talked about that? As a result, you can see that we can produce the abduction, adduction away from the midline towards the midline. We're talking about that also in the beginning. And as a result, the only thing mainly which cannot be done in this case, this is mainly the part of the rotation. The rotation by the by the digits cannot be performed by all of the things. Even the circumductory type of the movement can be produced by the metacarpophalangeal joints. So what I want from you is that, and what is my advice, to go through every and each structure, like bone joint, bone joint, bone joint. It will be easier for you to understand. Okay. Any questions? Hello. Okay. Thank you very much. Let me stop the recording. I do believe you know what